Welcome, everybody, to another episode of Wellness Wednesday Inspiration. My name is Fernanda, and I am super excited about being here today with Dr. Linda. We have a topic that is so important, is so common, it affects so many people worldwide, and it's one of the leading causes of death here and also worldwide. The topic for today is cancer prevention strategies. What can we do about cancer? How can we prevent this condition, this disease? And cancer, like Les Brown was saying just 2 weeks ago when he was here on our podcast, is one of the most feared words in the vocabulary. So, and there is always something about prevention. It's always better than cure, right? Prevention, it's always better than now having a condition and having to deal with it and treating it rather than preventing it. So today it's all about prevention. How do we prevent cancer? And Dr. Linda, how are you doing today?
I'm great. How are you? We're both like wearing summery clothes.
Yes, it's like 90 degrees. It's beautiful outside. I am loving my life here in Arizona. I can't say that enough.
That's awesome. Now I'm doing great and just, I love, like, we haven't done like a podcast by ourselves in a while, or together, I should say, like this. So it's always fun, just going through the research and really trying to give the audience as much value and strategies that they can implement. But the key is always, of course, we can give them all this information, but if they don't do anything about it, and I think Les talked about a few weeks ago, we have had that conversation where there's so much information out there, and ignorance is a choice, really, with the abundance of information out there. And so it's there, but you have to apply it.
Right.
So that's the other thing, and like you were saying with cancer, it's everyone. We've all been impacted, maybe not personally ourselves, but we know someone, whether a family member, a friend, right? And then patients that come in to see us as well. They've had impacted by cancer.
Absolutely. I think everybody knows someone at least with cancer, like you were saying. So very important. And like I was saying before, it's one of the leading causes of death. We're going to get into more detail later, but that also influences our pockets. How much money is it being spent on cancer and curing cancer or treating cancer treatment, rather than focusing on prevention of it, so we don't have to deal with any of that, right? Not only in monetary sense, but time.
Yes.
How much time is it spent in cancer treatment, in doctor's offices, in follow-ups, tests, diagnostics, et cetera, et cetera. So let's jump right in. Dr. Linda, can you tell us what is cancer?
Well, I like to explain to people, I know when patients come into our office, we're providers, so we have to be teachers, and we're also coaches, right? So we really have to be a teacher, and we're going to be students for life, of course. But the way I explain cancer to patients is, they're abnormal cells in your body that cannot, I would say, do their regular job. That's not a bad thing, because we all have those type of cells. But when we have too many of them, then it becomes a problem. It's just like having one thief in the whole city, right? You're like, oh, okay, well, we're kind of watching him. But then when you get 1,000 of them in there, it's just like, it can create chaos, right? And it's the same thing. It's like with one, it's just like the body can overtake that. But when it starts to flourish and metastasize, which you're going to, can explain to them what it is, then it becomes an issue. And I really just try to explain it in very simple terms. I'm like, hey, there's cells that are not working properly at their optimal capacity. It's not always a bad thing. It becomes a bad thing when there's a lot of them that kind of get their whole gang together and then start taking over your body. How do you like to explain it to your patients in real simplistic terms?
What I say, it's normally the cells, normal cells, healthy cells, usually reproduce, and every cell has a lifetime, right? Like a lifespan. So depending on the type of cells, they die and then new ones are being created all the time. However, when there is an abnormal replication or growth of cells, and they usually grow much, much faster at a much faster pace, then we have something that it's called cancer, right? So it's an abnormal replication of cells. It can happen in basically everywhere in the body, and it's not normal. And something else that I also like to mention is that cancer is not genetic, right? Like we all think, well, my mom had it, and you can have the gene, but it doesn't have to express. So it's all about gene expression too, which we'll get into. But that's a simple explanation. It's just not normal. It's an abnormal growth and replication of cells anywhere in the body.
Yeah. And you know what's interesting though? It's like people think like it's now like normal for us to have cancer, or this is the new normal. But it's not, like you said, it's not. It's just, it's more common. I think we get to decide what becomes normal. And unfortunately, big pharma, the media, they kind of decide like, you know, what goes out, what doesn't. So they start to creating the norm. And it's always, there's a saying that we say, how was this? There's a quote that whoever controls the narrative controls the people, you know?
So true.
Or like the media is controlling the narrative, which controls the people, kind of dictates what to and can't do. And I think that's why you and I don't watch television for that reason, you know? So let's talk about, you know, there's so many different types, but there's really the three most common type, you know, there's breast cancer, lung cancer, surprisingly, and prostate cancer. So when someone says, you know, I have cancer, those are really the top three. So do you want to share a little bit of like, you know, about each one, maybe a little bit symptoms, you know, what people look for, you know, because with breast cancer, it's a huge topic, but there's a lot of money in cancer research and cancer, right?
Right. So one of the most common types of cancer for females, although men can also develop it, and that's a misconception that men don't get breast cancer, they can.
Yes.
The symptoms basically are a lump in the breast would be the most common. However, it's not easy to feel it many times, depending on the location, depending on how big the breasts are or how dense the breasts are. So there is some workarounds, I guess, on being able to feel a lump, but most of the time there is usually a lump. Sometimes you can have skin changes. So from dimpling to redness to scaling, there could be, or like reddening, like almost there is something like an orange peel, sometimes abnormality in the skin. Also lymph node swelling around the area. So around the armpits, you can have some lymph node swelling, and even over here by the chest. So if you have any abnormal, something that feels abnormal, something that it's growing around the lymph nodes, then that could also be a sign. Something else would be a discharge in the nipple. Normally, unless you're breastfeeding, we shouldn't have any discharge, nipple discharge. So if you have any nipple discharge, that can also be a sign. The next thing would be an inverted nipple. So nipples should be protruding outward in a sense. And if your nipple is normally like that, and all of a sudden you see that it's inward, that it's actually going inward, that could also be a sign. And then, of course, pain, which is not a good estimator of any type of cancer. Usually when you have pain, it's because it's already a little bit more advanced, but pain can also be present. The way to diagnose it, for the conventional way to diagnose it, is a mammogram. Usually starts at the age of 40. However, there is controversies whether or not mammograms are actually detecting many types of breast cancer, and if once they detect it, it's usually big, et cetera, et cetera. So it's up to your discretion always to find the best information for you, what you want to do for your health, and how you want to advocate for your health. But that's the traditional way of detecting it, aside from doing a self-breast exam. You know how your breasts feel, you know how it looks, you know your body. So if you know that something's wrong, something's abnormal, just get it checked out.
Yeah, I did want to mention something really quick. I'm so glad that you mentioned that, because there's also thermography. I don't know if you've ever implemented that with your patients, thermography. I know like Dr. Christine Northrup. She's like the like the expert when it comes to, you know, women's health. She's been around for such a long time, and she's kind of one of the pioneers when it comes to women's health and hormones and so forth. But she really is an advocate for thermography. Now, I've had that done, and in lieu of taking my mom to get a mammogram or myself, we'll do thermal imaging, which will pick up like the, you know, some of the hot spots, the warmth in the skin, but they don't diagnose you with that. It's just a screenings tool. And they'll say, you know what, you need to take this a step further and get this evaluated, whether it's running some specific blood markers, whether it's a biopsy, because I've had a lot of patients that, you know, the doctor, they'll do a biopsy and they're like, you know, probably 70 to 80%, it was negative, nothing. So, and like you said, you know your body. So
very true. And thank you for bringing that up. Absolutely. Very important. Now, the next cancer would be lung cancer. Very, very common as well. Very closely related to cigarettes. And that's because cigarette is a chemical, something that does not belong in the body. And when we are constantly exposing our bodies to chemicals, then abnormalities can occur. However, the symptoms are cough. Usually that cough can be followed with blood, sputum. So blood in your sputum. And sometimes pain in the chest, shortness of breath, wheezing. And at times you can also find the lymph node swelling. So that swelling around your gland swelling around the armpits, also the chest, neck area. The most common symptom would be an abnormal cough, simply a cough that just doesn't go away. So if you have something like that, once again, getting it checked out, advocating for yourself, having a cough, no matter what, it's not normal. Normal is health. So if you have some symptom in your body, whether it's a cough, losing weight, abnormally losing weight without even trying, anything like that, just get it checked out. Anything to add, Dr. Linda?
No, I think you've nailed it. One thing though is even with like lung cancer, people that have never even smoked can also get it. Like you were saying with breast cancer, it's just not women, you know, it's just like men get it too. Same thing with lung cancer. It's just not, you know, smokers, non-smokers. I remember one of my pastors in California never smoked. And he was diagnosed with lung cancer. And that's what he died from. So, you know, a lot of it has to also do for also environment. It's like, what are we breathing in? What's in our home? You know, there's so much that we can get into, but you know, just making people aware of their body and just really getting zoned in on how you feel and just exactly what you're saying, you know, symptom wise. That's the normal is for us to be healthy, energetic, our skin, our motion, our movement, our sleep, having all those tracked in, which we're, you know, tapped into, which we're going to talk about. So another one, number 3 would be prostate.
Prostate cancer, usually for men only. That is exclusively yes. Women cannot get it because we don't have a prostate. But the symptoms usually are abnormal urination, whether it's you're urinating too frequently, you're not urinating enough, you're having difficulties starting the urine, you are urinating at night, you are urinating and it's painful when you're urinating, anything related to urination being abnormal. The most common, though, most common symptom is blood in the urine. It is not common to have blood in the urine. So if you do see blood in the urine, get it checked out. That is just not normal, no matter what. And aside from that, the other symptoms would be bone pain. Sometimes it follows, and erectile dysfunction can also be present with prostate cancer. Now, to get it diagnosed, most often it's the digital rectal exam, which most men dread. They don't like it. But it gives the provider an ability or the opportunity to feel the prostate and see if there is any hardening, if there is any inflammation, if there is anything that feels abnormal, as well as a blood test. And the blood test is to check for an antigen. It's not specific for cancer, but it can give the provider an idea if cancer could be present, in which case you would need a biopsy and some other stuff.
Yes. No, absolutely. And the challenge with this, with the prostate cancer, men do not like to go to the doctors, right? It's like our practice has always been what, probably 70 to 80% females. Men, oh, whatever, it's just a little blood, so I'm penal, so I can't. They blow it off. And it's like, no, that's your body telling you. It's just like driving your car and then the red check engine sign or an indicator goes on. You don't put masking tape over it and ignore it like, oh, no problem. I don't see that anymore. And that's, the same thing with like prostate cancer with men. They just will not take action until really it's interfering their life. So
Very.
that's what I have seen a lot.
That's a very important point because it's so true for all men around. Just get it checked out.
Yeah.
Get it checked out.
Now there's different types of cancers too. There's, so many different types. If you wanted to hit on some of the different types of cancer, because people say, oh, I have, skin cancer, or I have a sarcoma, or, what about leukemia? Because there's different types and there's specific, there's different types and like the most common that is, you talked about breast, lung, and prostate. Those are more epithelial types of cancers.
Yes, so we have carcinomas, which are the ones on the skin or tissue lining, right? Kidneys, liver, breast, and of course, once again, skin cancers. They can remain in the site where they originally started, or they can also spread out. It depends what type of cancer, of course. Sarcomas, which are bone and connective tissue cancers, like muscle and bone cancers. Those are sarcomas. Then we have leukemias, which is a blood cancer. And so what happens with leukemia, it affects the normal reproduction of your blood, your cells, and it starts in the bone marrow. Then we have multiple myeloma. Multiple myeloma, it's also a blood cancer, but of the plasma cells. So it's simply a different type of cancer. It usually affects people with the lower back, and you see abnormal fractures in your spine for no reason, no accident, no faults or anything else, and then just a weird back pain, and usually most common in the middle upper age, I find.
Yeah, and what you're mentioning about that, like sarcoma and multiple myeloma, I do see those quite a bit in our practices, as you were saying, because people, when you have pain, even when you just have pain by itself and don't have like any other symptoms, and it's like an unrelenting pain that wakes you up at night, or it just does not go away. And then there'll be people that come, oh, my back hurts, get an adjustment, and it doesn't go away. I'm like, okay, this is more than just, sore muscles, ligamentous tendon issues. There's something more. And that's what the importance, it will show up in x-rays. And I've seen, especially like multiple myeloma and even like sarcomas, those are very distinguishable on x-rays. Multiple myelomas, they look like there's little punched out holes, right? And then the sarcomas are, you can just see that. So I just kind of wanted to throw that in because that pain is an indicator of that.
Yes. And many times, like you were saying, it's the only symptom that presents, right? Just a pain that doesn't go away. No explanation, no reason for it. Then we have melanomas, which is a type of skin cancer, actually the most serious type of skin cancer. We also have brain and spinal cord cancers, and they can literally happen in anywhere in the brain, anywhere in the spinal cord, in any type of the cells that we have in our brain and spinal cord. There's different types, different variations of brain and spinal cord cancers, and of course they also vary in severity by grades, right? Grade 1, 2, 3, and 4. And then we have lymphomas, which are a cancer of the lymphatic system. So depending on where your cancer is, it will depend on what type of cancer you have, whether you have a sarcoma, melanoma, lymphoma, leukemia, etc. It varies depending on the location. Now, a lot of these cancers can also spread, can also metastasize to other parts of the body. However, the name remains depending on where it started.
Mm-hmm. Yeah. Yeah. And a lot of people don't know that because they're like, well, did it metastasize? What does that mean? Did it metastasize, or, is it localized? And so I think it's great that people just kind of have a basic understanding of, of what cancer is and the different types and common and what to look out for, and to never underestimate pain. That's a signal that your body is telling you something. So,
Mm-hmm. Mm-hmm.
so thanks for sharing all that. And so I wanted to mention also. I mean, I know that with the patients that we see, well, one thing, causes of cancer. Let's get into that. However, I've always kind of put it in three categories. And I always talked about, well, number one, it's going to be stress. It's going to be stress related. And stress is the physical, chemical, emotional. And I always told patients that, the physical stress of, not enough rest, working out too much, doing too much, injury of some sort. So that's going to be one, is the physical stress. The chemical stresses, and even like lung cancer, if a person is not a smoker, what are they breathing in though that's in their home? So then you have the chemical of not just the environment or not what just you're eating, but also the environment. So we're going back to our food, the soil, the water, all that. The other one with the physical is also not getting enough sleep, or even a good quality of sleep. And then I always say the emotional, which you and I like that. I think that's like the one that most doctors overlook, is the power of emotions and the emotional, because you can, and I've seen this, Fernanda, and I know you've seen this too with the patients that come in. They're eating right. They're exercising 5-6 days a week. They're doing yoga. They're eating everything organic, grass fed. They're doing everything right. They're like, I have the best husband. I have the great kids. I'm thriving at work. But there's some emotional baggage that's within them that's just going in circles and circles and circles and circles. And that's just in their subconscious mind. And they're not even aware of it. And that's why we always go back to that whole mind training. And even if you look at some of these cancers, I wanted to mention this because we both like Louise Hayes. And this isn't science-based, but this is more of what she has seen over the years. And there's a book called, it's From A to Z, The Symptoms of Louise Hayes. I don't know if you've seen that book. And so, okay. So what's interesting is I was pulling up, and with the cancer, a lot that has to do with cancer, kind of emotions associated with, has to do for women with mothering, nurturing, or nourishment, or refusal to nourish self, which is interesting because as moms, what do? We sometimes don't think that we're like the best moms. We're not doing enough for our kids, or we feel guilty because we're out and we're working. I was a single mom for some time, and I was working. And then just the guilt of, I'm not there for them 100%. So there's some issues with the breast cancer and that. And then the lung cancer, the emotional connection with that was kind of not able to enjoy your life, not really taking in life, because there's always concern of everyone else. So you don't really ever get the opportunity to fully live and express your life as you want to, because you almost feel guilty of being too happy and that everything's going well in your life. You almost feel like you have to be a martyr for everyone else. And I knew a pastor that was like, great man. So I'm like, I wonder if there was some emotional connection with that. And then with men, with prostate cancer, it's more about men and their masculinity. And I think as they get older, they just feel like their testosterone levels are dropping. They don't feel like they're the men that they really should be, that they're not showing up 100% for their family. So did you see some of those commonalities with the emotions?
Yes. And I was actually thinking as you were talking, when we had our podcast on the energy centers.
Yes.
It literally, what you're explaining right now goes hand in hand with what we talked about on that podcast episode. When we have emotional baggage that gets trapped in the body, negative emotions that get trapped in the body, depending on where they are, they will cause disease around that part of the body. So If it's the heart energy center, it can cause problems with the heart and the lungs.
Yes.
Right? Even breast cancer, if it's the solar plexus, if it's the second energy center, if it's the first energy center. So depending on what emotion, is it grief, is it anger, is it frustration, is it fear, what emotion do you have going on in your subconscious mind? What's the movie that you're playing over and over and over and over in your subconscious mind? And that energy, wherever it's stuck, it can cause disease, including cancers.
Mm-hmm.
So very, very interesting that you literally are explaining how basically the energy gets through our bodies,
Yes,
right? In and
yes. Now, I know we both have been doing a lot of meditation, and there's a meditation of blessing of the energy centers. And I wanted to share this with you actually, live, because when I have been, it's a longer meditation, about an hour and 20 minutes. But when I'm done with the meditation, I kid you not, Fernanda, I feel like my cells, my genes have been upgraded. I feel like something like things are being cleared, like the different energy levels, and which are associated with different organs, and they have their own little community and so forth, and emotions connected with them. So it's really, really powerful. So what are you seeing that some of the causes? I think we probably both agree on, it's always going to be the stress with those three: physical, chemical, emotional. Those are huge.
Mm-hmm.
Yeah. And I think someone mentioned here that, the common household cleaning products are really toxic too, which yes. And our skin is the largest organ, and then we're touching all that, or we're breathing that in. So yes, 100%. And trauma, like, Emily here mentioned, trauma is a big thing. Yes. Our body remembers everything, it has a memory. And so those are some of the causes. So can you kind of share, because you've been in the field where traditionally cancer is treated a certain way. There's a certain protocol that, being in the medical field, you are taught when you're in training, when you're in school. There's a specific protocol, there's maybe three of the most common ways that they go after the cancer, whether it's, they remove it, whether it's radiation, whether it's chemo. Can you kind of explain a little bit what those three are, just for people that don't know?
Of course. So surgery is one of the treatments used for cancer. If the cancer is localized, meaning it's in one place, and there is a specific tumor that they can go in and take out, many times they would go and do surgery to remove, in an attempt to remove the entire tumor, basically. And so after a surgery, they would make sure that all around the tumor that they remove, the margins, quote unquote, or the edges, the external part, the outer part of the tumor, it's clear. There is no cancer left. And so that's one of the main treatments. The other one that it's commonly also known is radiation. So radiation also works for a localized type cancer. If it's in one area, they can send high beams of radiation, usually X-ray type beams, to that specific area of your body. Now, there is also, of course, risks with surgery. When you go under anesthesia, there is always a risk for infection, something, of course, not going the right way. With radiation, usually a lot of skin irritation happens. If it's near hair or mouth, it can cause a lot of dryness around the mouth, hair loss as well, but a lot of skin irritation because they're hitting you with a very high beam of basically energy, right? And then the other one is chemotherapy, which is also extremely common, unfortunately. And that can be given IV, that can be given in your bones, that can be given as a medication, even applied on your skin. And so what it does is they give you all these very high medications, chemicals, I would say, that literally go into your body, and the job is to destroy rapid growing cells. So like we were talking about at the beginning of the show, cancer is rapid growing cells, abnormally rapid growing cells, but also are your hair, your skin, I mean, not your skin, your nails,
Your nails.
right? And so it destroys all of the rapid growing cells in your body. It does not have the ability to distinguish between cancer and not cancer. It just destroys all of the rapid growing cells. So that's why a lot of people, once they start chemotherapy, they go bald and they start having a lot of nail like falling off and all of these other symptoms because of the cancer basically killing these cells. There's a lot of side effects associated with chemotherapy. The side effects range from pain, nausea, a lot of nausea, weight loss, and fatigue, and just overall feeling like literally like the worst flu of your life for days after you finish the therapy. And there is a lot of time commitment. It takes a very long time to get it delivered in your body, and it usually requires frequent visits to get the treatments. Now, I did pull the cost associated. Usually about 4 billion a year in medical costs go for cancer care. And for an average patient, and this is just average, so it can go a little bit higher or a little bit lower, around $25,000 every single year for cancer care. So
That's huge.
And that's with insurance, of course.
Yeah.
Without insurance, it's just astronomical. So something to keep in mind, definitely.
Yeah. And then like we were talking about earlier, it is preventive. We can take a lot of preventive measures. We are just being fed that we just get this, we never get to the cause. We never get to the root cause. And we did talk about what is the root cause. It is a stressor on the body. It's the physical, the chemical, emotional. So if we take some preventive strategies to do that, and when people come to see me, they've probably been to 10 different doctors. They've been to oncologists. And, I always tell patients, I'm not treating here a symptom. We're actually working with your systems. What's creating your system to be off balance, especially your immune system? And where is your immune system? 60 to 80% of it is in your gut. And so why is it malfunctioning? What's going on? And then, we address those. And what I wanted to talk about too is, if a person does have cancer, what should they do? Well, one, you have to decide, do you want to do the traditional approach? Number one, some people are going to say, yep, sign me up 100%. And then you have some that are like, you know what? Nope, I'm going to go the alternative approach and I'm going to do everything natural. And then you have others that do the integrative approach, which takes the best of both worlds. So you can actually have a doctor that's saying, this is what's going on, is very specific. And then you have another one that's like, okay, how can we combine the best of both worlds? And everybody just has to make a choice, what's right in their heart. Maybe it's so progressive that it's like, you know what? One person will choose, let's get it out of there. We're going to have it surgical removed, but I'm going to do my part with addressing the stressors of the physical, chemical, emotional, start eating the right foods, the exercise, the stress management, and so forth. So each person has to decide, and there is not one size fits all. We know that because you can have two people the same age with the same type of cancer, or even in family members, even in twins, and they both respond differently, and they both are going to require very personalized therapies.
And I think the bottom line and the most important thing over here to mention is that no matter what people decide to do for treatment, whether it's traditional, whether it's integrative, whether it's alternative, whatever it is that you decide, if you are not working at the root cause, then it's literally just kind of like that insanity, right? Doing the same thing over and over and over again, expecting a different result. So if you are doing the same thing, being exposed to the same chemicals, having the same thoughts in your head, if you are not exercising, if you're eating the same foods that got you to where you are at that point, and nothing changes in your life, but you're expecting something outside of you to make it change, if you're expecting a drug or something else for it to change, then chances are it's not going to change. So no matter what people decide, it always comes down to it's our responsibility. Cancer is not normal for anyone. So if you have cancer, it's literally the best time to look inward and say, okay, what got me to this point?
Yes.
What did I do that now I'm, put me in this situation, and how can I reverse that and start making different choices, different decisions, from the products that you have in your house, to what you're applying on your skin, to what you're eating, to how you're thinking, how much you're exercising, where you live, what kind of air you
Mhm.
breathe, et cetera, et cetera, et cetera. So always, always, always go back to the root of the problem. It's super important.
Yes, 100%. Exactly what you're saying, Fernanda. If somebody came to me, and this is kind of how I work with patients, and I'll give some kind of generic, I would say something generic that most people do really well with, especially like, let's just say supplements. Number one, get your diet dialed in and eat in the purest form possible. If you're going to eat vegetables, make sure that they're organic, as clean as possible. Same thing with fruit. If you're going to eat animal products, eat animal products that has been sustainably raised without all the drugs and the antibiotics and so forth, and you're drinking clean water, you're getting the rest. So you want to do some of those things. But if a patient comes in, or even a person's just like, um, what are some of the supplements I could take? Once again, you've got to work with the doctor one-on-one with that, because I always get the call, people message me, oh, my husband was diagnosed, or they Facebook me, my husband was diagnosed with this, what should he take? I'm like, I don't know. I don't know all the whole details. It's kind of like me driving to my mechanic and say, hey, listen to my car. What's wrong with it? He's got to get under the hood. You got to get the right testing done. It's like, you got to look at the emotional aspect, but really, it's really hard to go wrong with vitamin D. Okay, definitely vitamin D levels. I always tell patients like 5,000 to 10,000 I use, and you definitely need to get that tested. Magnesium is another one. Okay, I always encourage, most people are low in magnesium, so anywhere from 300 to, even some studies show, like in Japan, even as high as 3 grams of magnesium per day. Um, Another one would be probiotics. Has a lot to do with the healthy gut bacteria. So that was number 3. Number 4 would be even something like curcumin. Because I think we can agree that cancers are an inflammatory condition that takes over to the body, and the curcumin, turmeric, it really will dampen that. And I would say even like a gram. And the last one would be like fish oils. So I even like to dose on fish oils with the EPA, DHA, higher with DHA for me for brain health. With someone like young like you might benefit more from EPA, because there's different types of fish oils. One's very specific for the brain, one's more specific for overall and even heart. So even going as high as 3 grams. So a lot of these you have to work individually with a provider, because you go through a phase of super dosing, and then you go back down. And someone mentioned, yes, inflammation and everything that we covered, vitamin D, fish oils, curcumin, those all help with the inflammatory process, and even the probiotics can. And then magnesium, of course, there's over 300 functions that are magnesium dependent. So kind of just wanted to throw that in there. And, if somebody would come to me, this is what I would tell them. I would love to see how you would work with them. Is one, the sleep, the exercise, the diet, and have a group of doctors. Just don't go see one doctor. You want to hire all these doctors to be part of your team. It shouldn't just be one person. I don't want with just one patient coming to see me. I'm like, no, go see this fellow. He's a specialist in that. Let's get his information, and then let's all talk and see what's best for you. But you need a team. You can't do this by yourself. If you try to do this by yourself, there's so much misinformation out there. Good luck. It's going to be a nightmare. But I think one of the most important, Fernanda, is to get a mindset coach. Because you could do all of these, but in your mind, if you're doubting and that story of, oh gosh, okay, what's going to happen to the kids? You start going the way like, oh, it's not going to work. So your body is hearing everything you say. So I really think that's something that most practitioners need to address, and hire someone, or refer out to someone like yourself, because you do a lot with mindset. I do a lot with that with my patients as well. But That is, I believe, one of the biggest missing keys.
I agree. Really quick, I know you do have to go, Dr. Linda. Barry asks, what are your options on sugar detox? My opinion on sugar detox is sugar is a toxic toxin. So just get rid of it altogether.
Yeah.
If you can, it's not necessary. You can replace it with healthier, like pure honey, pure organic honey, or something different. Sugar, it's literally just putting a toxin or a chemical in your body that it's completely not healthy and unnecessary. So yes, absolutely. And I do want to end up on that term that you were talking about with the mindset coach, with no matter what anybody says to you. They can tell you you have 6 months left. They can tell you you have 3 years left. They can tell you you have the most severe type of cancer. They can tell you nobody survives the cancer. And no matter what people say to you, you create your reality. Once you take somebody else's opinion and you ingrain it in your mind and you make it your reality, it's a done deal. You're done. Your fate, like it's gonna happen no matter what.
Yeah.
So even if they tell you something like that, don't believe that. You can create a different reality. We've all known of people that were given 6 months to live and they're still alive right now.
Yeah.
So if it happens to one person, it can happen to someone else, because it's all about changing your mindset. Once you change your mindset, once you give an upgrade to your cells, to your DNA, you can literally cure yourself from so many different conditions. Don't believe somebody else's opinion to be your own. Don't adapt it. Don't integrate it into your brain. Don't believe it. If you believe it, then it becomes, basically will become your reality. So that's something super important, that no matter how many degrees the doctor has or how many, no matter what they tell you, you create your reality. You are in control of your health and your fate.
Absolutely. And I just want to add a couple little things to that, but you nailed it beautifully. One is choose to be the exception and not the norm. You know, maybe that's the norm what most doctors see, but you're going to be the exception. You're going to be the exceptional patient. And I'm like, no, doc, I'm the exception to that norm. And number two is just like, how do you do that? You don't wish for things to be easier, right? You become better. Remember who said that? You know, what's that?
Jim Rohn, of course.
Yes. Don't choose for things to be easier. Choose to be better. That's the winner right there in all areas of life. So I think we covered a lot. So that was like, jam-packed. I think a lot of people are going to walk away with a lot of value. But yes, mindset, oh gosh, that's like the missing link. And if there's an integrative center that has, you know, the whole team under one roof, that would be great. There's not too many of them. And just getting something customized and personalized for you. So.
All right. Well, really quick, Dr. Linda, just one thing you're grateful for. We gotta go.
Oh gosh, just our time here together with you. I'm so grateful every single week, and the people who listen to listen and just share the information with others. So I'm just so grateful for that.
Beautiful. And I am actually very grateful. And I think I texted you that just a few days ago. I'm so grateful for you and the podcast as well. It's just, it provides such a great opportunity for us to get this message out and empower people to take control. And just very, very thankful for that, and our listeners, of course.
Yes.
And with that, we are going to call it a day. Thank you for everyone who connected. We will see you guys next week at 1 p.m. Pacific Standard Time.
Yes, absolutely. All right. See you all. Bye.